If you're trying to prepare your body for pregnancy, there's a good chance you're focusing on the wrong things. If you watched my last video, we talked about normal labs and why normal doesn't always mean that your body is ready to create life. So today I want to talk about what readiness actually looks like and how to prepare your body for pregnancy in a way that supports long-term health, not just conception. There are 3 shifts I want you to understand. The first shift is this: stop optimizing symptoms and start building capacity. A lot of pregnancy preparation focuses on tracking, supplement stacking, or trying to perfect individual hormone markers. But pregnancy is not about getting just a positive test. It's about sustaining life for 9 months and thereafter. That requires metabolic capacity, nervous system regulation, nutrient sufficiency, stable blood sugar, adequate sleep, and resilience to stressors and your stress response. So instead of asking, how do I boost progesterone? Asking a better question might be, is my system supported enough to allocate energy towards pregnancy? Because pregnancy is energetically expensive, and your body will prioritize survival before reproduction every time. The second shift is learning to regulate before you intensify. What I often see in couples is doing more. So more tracking, more supplementing, more interventions, more pressure. But if your nervous system is in a state of constant vigilance, even subtle vigilance, adding more inputs doesn't always create safety. Fertility responds to a parasympathetic tone. It responds to signals of, I am supported, I am resourced, I am not under a threat. You can't pressure your body into feeling safe. So before intensifying your efforts, it's worth asking, is my body regulated? Is my sleep consistent? Is my stress response adaptable? Do I feel safe in this process? Because regulation is going to change your physiology. In the third shift is thinking in systems instead of checklists. So preparing for pregnancy isn't just about checking boxes. It's about strengthening the entire system. Your thyroid doesn't operate alone. Your reproductive hormones reflect upstream inputs. Sperm health reflects sleep, inflammation, metabolic status, blood sugar regulation. That influences ovulation quality. And your inflammatory load absolutely affects implantation. So when you actually zoom out and evaluate the patterns, instead of just isolated numbers, preparation becomes much more strategic. And instead of chasing a single lab value, you ask, how is the whole system functioning? And that's where real clarity starts. Preparing your body for pregnancy doesn't require perfection, but it does require support, clarity, and a willingness to build a foundation before chasing outcomes. If you've been trying to prepare but feel like you're spinning your wheels, that doesn't mean that you're failing. It just means that you may need to look at things differently and through a different lens. I created a free 30-minute workshop that walks you through exactly how I look at fertility, so you can decide if this approach aligns with you. It's linked below. In that workshop, I break down the systems-based framework when working with couples preparing for pregnancy, so you can understand what to evaluate and why.